Pulmonary embolism is a serious and potentially life-threatening condition where one or more arteries in the lungs become blocked by a blood clot. When this happens, it restricts blood flow to the lungs, affecting the oxygen supply to the rest of the body and potentially causing damage to the lung tissue. The blood clot that causes a pulmonary embolism usually forms in another part of the body, most commonly in the deep veins of the legs or pelvis. These clots forming in the legs or pelvis are known as deep vein thrombosis, DVT. Once one of these clots forms, it can break off, travel through the bloodstream, and lodge in the lungs, resulting in a pulmonary embolism. Pulmonary embolism is more common than many people realize, and its seriousness demands awareness. In the United States alone, it's estimated that between 60,000 to 100,000 people die from pulmonary embolism each year. It can affect people of all ages, although the risk increases with age. Causes of pulmonary embolism. The causes of pulmonary embolism are closely related to blood clots, which are often triggered by a combination of risk factors. There are three main factors that contribute to blood clot formation: inactivity, endothelial injury, and certain medical conditions. Number 1. Inactivity. This can happen during long flights or car trips, extended bed rest due to illness or surgery, or even sitting for long periods at a desk job. When we're immobile, blood flow in our legs slows down, increasing the likelihood of clot formation. This is why it's often recommended to move around or do leg exercises during long flights. Number 2. Endothelial injury. This cause refers to damage to the inner lining of blood vessels. This damage can occur due to surgery or injuries like bone fractures or muscle tears. These injuries disrupt the normal function of the blood vessel's walls, making it easier for clots to form. Even minor injuries or fractures can trigger the body's clotting mechanisms, and in some cases, the clot that forms can become large enough to cause a pulmonary embolism. Number 3. Medical conditions. Certain medical conditions and genetic factors can cause someone to have blood with high tendency to clot. For example, people with inherited clotting disorders like factor V Leiden or prothrombin gene mutation are more prone to developing blood clots. Additionally, certain conditions like cancer, autoimmune diseases, and pregnancy can increase the risk of clot formation. Medications like birth control pills and hormone replacement therapy can also contribute to blood clots formation, especially in combination with other risk factors like smoking. Symptoms of pulmonary embolism. When a pulmonary embolism occurs, the symptoms can vary greatly depending on the size of the clot, the number of clots, and where exactly it gets stuck in the lungs. The most common symptom is sudden shortness of breath. This breathlessness typically comes on quickly and worsens with exertion, but it can occur even when a person is at rest. Breathing may become rapid or shallow. Many people describe it as feeling like they can't get enough air, no matter how deeply they breathe. Chest pain is another hallmark symptom of pulmonary embolism, and it's often described as sharp or stabbing. The pain may worsen with deep breathing or coughing, which can sometimes lead people to mistake a pulmonary embolism for other conditions like a heart attack or pleurisy, which is inflammation of the tissues around the lungs. The chest pain associated with pulmonary embolism usually stays localized to one area, but can radiate to the shoulders, neck, or back in some cases. In addition to shortness of breath and chest pain, people with pulmonary embolism may experience a rapid or irregular heartbeat. This happens because the heart has to work harder to push blood through the blocked arteries, leading to palpitations or an awareness of a fast-beating heart. As the heart strains to compensate for the reduced blood flow, some people might feel faint or lightheaded. In severe cases, this can lead to fainting or collapse. Coughing is another symptom of pulmonary embolism, and it may produce blood-tinged sputum or phlegm. This happens when the clot causes damage to lung tissue or when blood vessels in the lungs burst under pressure. Other symptoms can include leg pain or swelling, which could be a sign of an underlying deep vein thrombosis, and feelings of anxiety or dread, which are common in people experiencing pulmonary embolism due to the sudden and severe nature of the symptoms. Diagnosis of pulmonary embolism. Diagnosing pulmonary embolism can be challenging because the symptoms overlap with those of other conditions like heart attack, pneumonia, or anxiety attacks. However, early and accurate diagnosis is crucial because pulmonary embolisms can quickly become life-threatening. When doctors suspect a pulmonary embolism, they will start with a detailed medical history and physical examination, focusing on risk factors like recent surgery, immobility, or previous history of blood clots. The next step is usually blood tests. A common test is the D-dimer, which measures the levels of a substance that's released when a blood clot breaks down. Elevated D-dimer levels suggest that there's an abnormal amount of clotting activity in the body, which could indicate the presence of a pulmonary embolism. However, high D-dimer levels can also be caused by other conditions, so this test isn't definitive on its own. Imaging tests are key to confirming a diagnosis of pulmonary embolism. One of the most widely used tests is a computed tomography pulmonary angiography, CTPA. This test involves injecting a contrast dye into a vein and then taking detailed CT images of the blood vessels in the lungs. A CTPA can reveal the presence of a clot and show exactly where it is located in the lungs. In some cases, a ventilation perfusion scan might be used instead of a CTPA. This test involves inhaling a small amount of radioactive gas and receiving an injection of radioactive material. The scan then shows how air and blood are distributed in your lungs, helping to identify areas where blood flow might be blocked. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for pulmonary embolism. The main goals of treatment are preventing the clot from growing or moving further into the lungs, as well as stopping new clots from forming. Anticoagulants or blood thinners are the cornerstone of treatment for pulmonary embolism. These medications don't dissolve the clot that's already there, but they help prevent it from getting bigger and reduce the risk of future clots. The most commonly used anticoagulants include heparin, which works quickly and is often given through by injection, and warfarin, which is taken orally and is longer acting. Newer anticoagulants like rivaroxaban and apixaban are also available and are often preferred because they don't require as much monitoring as warfarin. In cases where the clot is massive or life-threatening, more aggressive treatment may be needed. Thrombolytic drugs, sometimes referred to as clot-busting medications, can be used to dissolve the clot more quickly. These medications carry a higher risk of bleeding and are usually reserved for severe cases where the benefits outweigh the risks. In some situations, surgical intervention may be necessary. One option is a procedure called catheter-directed thrombolysis, where a catheter is threaded through the blood vessels to deliver clot-dissolving medication directly to the site of the blood clot. Another surgical option is an embolectomy, where the clot is physically removed from the lung. For people who can't take blood thinners due to the risk of bleeding, a filter may be inserted into the inferior vena cava, which is the large vein that carries blood from the lower body to the heart. This filter can catch clots before they reach the lungs, reducing the risk of pulmonary embolism without the need for anticoagulation. Recovery from pulmonary embolism can take time, and the duration varies depending on the severity of the embolism and the individual's overall health. Most people will need to continue taking anticoagulants for at least several months after the initial event, and some may need to take them indefinitely. In some cases, lifestyle changes are recommended to reduce the likelihood of clot formation in the future. This can include staying active, avoiding long periods of immobility, maintaining a healthy weight, and stopping smoking. Now, we want to hear from you. Have you or someone you know experienced a pulmonary embolism? How did you first recognize the symptoms, and what was the treatment journey like? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.